My name is Christian Stella, Pharm D, and this is Precision Opinions Live. I welcome Joel Thomas. Joel, where do you work exactly?
So I currently work at two places. I'm at CVS right now and New York Presbyterian Queens.
Okay. So you're at Presby hospitals making IV bags, which is fun. We know that. And you're also at CVS, which is good. Also St. John's, right?
Yes.
Too. So St. John's candidate 2021, working there, learning as much as you can. And you also were here for a little bit, which is cool. But today we're having you on to discuss the space of rheumatology and low-dose naltrexone. So I want to kind of start and do the introduction as if you can explain to everyone what low-dose naltrexone is for the most part.
Sure. I just want to first off start by saying, thank you for having me on. It's a pleasure. So let's get into it. Low-dose naltrexone, LDN, it's a compounded form of regular dose naltrexone constituted from naltrexone powder and in a compounding pharmacy such as Precision Pharmacy. So the doses that we have are ranging from 0.5 milligrams to 4.5 milligrams daily, and it can either come as tablets, capsules, suspension, strokies, blister packs.
Perfect. Yeah, so pretty much we can make any sort of which way low-dose naltrexone, but most common is to do a capsule, tablet, and to slowly titrate it up. The blister pack is starting at 0.5 and ending at 4.5 to get them at the goal dose. Some physicians may even go up to 6 or 8, but it depends on what their certain protocols are. But let's talk about the mechanism now. What's going into, because I know it's kind of complicated. There's a couple different ways it's worked by chirality.
Yes. So with the mechanism of action, we have two arms. We have the L isomer, and then we have the D isomer. So the L isomer blocks the opioid receptor at a low level, which is different than regular dose naltrexone. It blocks it at such a low level, causing negative feedback within the body, and it tricks basically the immune system to release endorphins. Endorphin release can have many physiological functions, but for our purposes, what we're going to focus on is its effect in relieving pain and reducing stress. For the D isomer, we have its mechanism being to block several subtypes of immune cells, which are called toll-like receptors, TLRs. So specifically, we have TLR4 and TLR9, and these receptors are located on macrophages called microglia cells. And normally, when these cells are activated, we get neurotoxic effects, and because of the activation of pro-inflammatory pathways and excitatory pathways. So we can get things like opioid tolerance, neuropathy, downregulation of GABA receptors, and activation of oncogenes. So with this D isomer, once we block those pathways, we basically get the reverse. So we get neuroprotection, we get controlled pain states, and we get cancerous cell death.
Yeah, so that's where all the chaos is going on, where the glial cells. We want to stop that. We want to say, hey, hold on. So how does taking all that information, how does that relate to these conditions in rheumatology?
So the big question we have is, how can LDN be used in autoimmune diseases? Well, before we get to that, the root cause of autoimmune disease, simply stated, is abnormal inflammation, right? So inflammation is generally helpful. Let's say you have a cut on your finger and you're bleeding out, or if you have a cold, right? Inflammation will help to kind of clot and stop the bleeding. It'll help to get the pathogen out of your body. But in autoimmune diseases, you have abnormal inflammation, so the body really can't tell the difference between healthy tissue and non-healthy tissue. So there's just constant attack on both, and people will essentially be constantly feeling pain, constantly being sick, and your immune system isn't up to par of what it's supposed to be. So that's basically what we're trying to treat when it comes to autoimmune diseases like lupus, abnormal inflammation. The first step with LDN is basically to treat that abnormal inflammation. And then the second step is basically to give the body a chance to heal itself, to regenerate itself through its own healing mechanisms. And through those mechanisms, we get, like we talked about with the L-isomer, some endorphin release. So, relieving pain, decreasing that stress. And we have some advantages of using LDN. You get LDN isn't immunosuppressive. So basically, if you're on a chemo regimen or if you're sick or anything like that, you don't have to stop the medication. You could just continually take it. And like I mentioned before, LDN works synergistically alongside with your body's healing mechanisms to heal to kind of heal itself.
Correct. Yeah. So it uses both of those mechanisms, and it kind of uses most of the dextroside to kind of reduce the inflammation, but it's also using the influx of the influx of neuropeptides and so on and so forth. So yeah, it's definitely a great medication when it comes to this space and autoimmune diseases. Certain doctors, certain physicians out there, they like to take patients off gluten. They like to try to fix the gut. So however they're going to go about it, but this is always low-dose naltrexone is always used with other medications, or it's used with other kind of techniques in this field. What about some side effects that you could see with LDN?
Sure. So obviously, taking any medication, you'll experience some risks, and it's no different with low-dose naltrexone. Some of the risks that you'll see will be like insomnia. So if a person is normally sleeping, and then once they start taking the medication they're not, or if it could happen if the reverse happens, if the person is normally not sleeping, they're having difficulty sleeping and they start sleeping, that's still something to monitor. We can also get headaches, potential liver enzyme elevations. And it's also important to note that, like, if people are taking pain medications already, you shouldn't be giving low-dose naltrexone because of its mechanism. It'll basically force people into withdrawal. They'll experience withdrawal symptoms, and, that's kind of not what, we want or doctors want. So.
No. You don't want someone withdrawing from their oxycodone at all. When it relates to sleep, it can also cause, which is interesting, it could cause nightmares, which is, you see that in some like Chantix and this and that, which is crazy, but we hear it often. But yeah, the opioids, you want to make sure that they're not on an opioid. Some physicians, if they've been doing this for a while, they may start the patient on something like 0.1, very, very low, and do it with their opioid, which is interesting as well. But I want to thank you for coming on. I want to thank you for all your help, everything, and I want to wish you luck in the future. You're a good guy.
Thank you. Thank you.
Be sure to search Precision Opinions Live on Stitcher, Spotify, YouTube, and Google Pods. And make sure to follow Precision Pharmacy on Instagram, Facebook, and all other social media platforms.